Someone says, Barbara says, I have significant digestive issues that emerged after COVID, especially due to sugar and carbohydrates. I've lost 50 pounds in the past 2 years. She called that upside. If I eat these things, my reactions can range from significant inflammation to gastric distress and vomiting. Any suggestions other than don't eat those items and the traditional medications my doctor wants for me to take? So does anyone have a response to that? Oh, here we go. Go ahead.
Well, I want to reflect what Dr. Wen said earlier, right? That we often see dysbiosis due to diet. So what would happen is if you came into one of our offices, I would have you bring a 3 to 7 day diet of what you eat, right? Not for purposes of judgment, but for purposes of looking at how, from a Chinese medicine perspective, and how with your presentation in this moment, right? What is right for you in this moment, and how can we tweak your diet? And whether that means that if you tolerate chia seeds, right? If you don't tolerate dairy, can you tolerate them in coconut water? Why? Or coconut milk. On the one hand, we would prefer it to be warm. So if you could tolerate miso, even better, because that's warm and probiotic. Do you respond well to probiotic tablets? Not everybody does. Everybody has different issues, right? So while putting chia seeds are fabulous because taking them for 6 weeks resets the gut biome with prebiotic fiber, but not everybody can tolerate that cold. So it might be that you have ginger tea before and then have the chia seed pudding, or that we use other foods, but it would depend what else is going on for you. And so I would take it from there with somebody in my office, but we would need to do a diagnosis and a download of what you're eating, what you tolerate, what you don't tolerate. Is it all carbs? Is it specific carbs? When you say carbs, do you mean white rice, white potatoes? Do you tolerate sweet potatoes? Do you tolerate lentil soup, right? Because legumes can be our friend when that's something that you tolerate. Dr. Wen, what do you have to add?
I think it's actually, this is a very, also very common, because one of the complications, from COVID is the impact on the pancreas. So to me, it sounds like the pancreas is like a low level of pancreatic inflammation. So that could affect, the digestive enzyme release. That also could affect the insulin release, and that's probably why. So it's like you need to see a provider, and so we need to do the diagnosis. But looks like to me that is the pancreas issue. Yeah, and from TCM perspective, it's still under the Shaoyang-Bing. You just add one more, like the Yang-Ming component into it. It's like a Shaoyang, the Yang-Ming combo. Yeah. So one of those approach we typically use for people with like insulin resistance or chronic pancreatic inflammation, that may help. Yeah, on top of like what Amy mentioned about the food. Yeah, the food definitely is a very important part of this. Yeah.
And I'd like to add that there's avoidance and then there's repair. Mm-hmm. So at first, if you're in a hyperreactive state, you want to avoid the foods that you're not agreeing with. But that's a sign that something's going on and that you're not tolerating. Maybe you're in a hyperinflammatory state. There's an imbalance. I see a lot of COVID, they have epigastric issues. So we utilize I utilize a very integrative approach of looking at what can you eat, what can't you eat, and also addressing and cultivating the digestive system so that you can absorb. So you're not stuck with only eating 20 foods for the rest of your life. So it takes time, but it can be done. This is one of the things that the food allergies and intolerances is something I've been doing for many, many years. And it doesn't happen overnight, but first you avoid, but then you also have to look at what's the underlying mechanism and repair that, and then slowly reintroduce. Okay, so there are some questions here. One person asked, what would you recommend for people who are needle sensitive and have strong reactions to acupuncture?
So we're looking at moxa and tuina and acupressure and Toyohari style, if anyone does that, and Qigong and Tai Chi and all of the things that we've spoken about. And I also use a cold laser, so I don't, on points when someone's really sensitive to needles. But you can also use the Teishin, depending on what someone's level of experience is with non-needle techniques. Dr. Wen?
I would also suggest if you can do a lymphatic massage. That's like I mentioned earlier, a lot of toxins are actually, hide in the lymph system and the interstitial system. So exercise, one of the benefits of exercise actually is like you activate the lymph system. Yeah. And so lymphatic massage is even more specific. Yeah. So try to get someone qualified, for doing that. Yeah. And so one simple thing is actually sauna, the dry sauna. That will be a way also help you to activate the lymph system.
There are so many therapies in traditional Chinese medicine. If you can't do acupuncture or you can't do herbs, whatever, it's a temporary situation, because as you get stronger, you will be able to tolerate. But we have such huge toolboxes that there's always a therapy, that there's always a way to find, even if it's starting with breathing, there's always a way. You got to take that first step to get someone to guide you back to health. I'm pretty much 90% telemedicine these days, and I'm still seeing the same patient population utilizing herbs, supplements. I do massage. That's the 10%, and acupuncture. So there's moxa. There's so many different ways, and the system is so developed. And then someone wants to know, how do you check your treatments for people with bleeding disorders such as von Willebrand's disease? That's on my intake, but
So I haven't had any patients with von Willebrand's. I have had many patients who are on Coumadin or Eliquis or other blood thinning medications. So I would speak to their doctor. I would, there's a standard piece where I ask in my paperwork for patients' permission to speak with their doctor, and I would just go over it with their MD to make sure they felt comfortable with everything I was doing, and have a conversation, and then base my treatment around that, because I've been practicing for a long time, and we can always find a way, as you said. And if it's not with a needle, it's with acupressure or with heat, whether it's moxa or a hair dryer, or, as someone put in the chat room, it's ear seeds or press balls or acupressure.
And here's a question that's pretty irrelevant: is many chiropractors offer acupuncture. Do these practitioners tend to be legitimate, or should they be avoided? I would like to say that acupuncture is one part of traditional Chinese medicine, and just the way we were talking about the ability to pivot and the ability to utilize other therapies in the system and get a diagnosis, that all comes from a lot of education and experience. And those who might be able to put a needle in because they took a 200-hour versus 2,000-hour program are not going to be able to utilize the full system to restore your health. It's like compartmentalizing it. So especially with those with invisible illnesses, you need a very integrative approach from experts. So that's my 2 cents about that. What would you say, Amy? I know this is
Okay, so my husband is a chiropractor, caveat. And my husband he was at that place where he needed CEUs, and the only class that was available was a dry needling class. And he went and he came home and he said, why would anybody want to do this? This is not, like, they don't know what they're doing. You know, I tried to get support for a dry needling bill in the Commonwealth from the chair of the AAMA, and which is the American Academy of Medical Acupuncture, which is an MD group that practices, and there are many terrific AAMA members. But this particular provider said, I don't use it because I refer to acupuncturists because you are the specialists. So what I would say is, if you have a musculoskeletal issue and it's legal in your state, because it depends on your state, whether it's legal for chiropractors and whether it's legal for other providers. But really, if you want to see the expert in the field, if I want to get adjusted, I'm going to a chiropractor. If I want to get acupuncture, whatever they call it, I'm going to an acupuncturist, because the level of training is so far high and above beyond. 200 hours is very different than 4,000 hours or upwards of, you know, we have to have 1,305 hours of acupuncture specific training to be able to practice acupuncture. That's a lot. And to be able to sit for the national board, which is a third-party national psychometric exam. So, you know, we pick our money and take our choice. I would go to the expert. If I want acupuncture, I'm going to see a licensed acupuncturist. But if I want to get adjusted, I'm going to a chiropractor. That's my 2 cents.
And Dr. Wen, the education level is even so much higher coming from China, right?
That's right. Yeah, it's you know, this is a very very tricky question. But my answer is like, okay, you need to check out their background, and you know, you need to see their license at least, you know, because the licensure process is definitely the minimum requirement, you know, to make sure you're do no harm, right? Yeah. So, you know, I just like Amy said, if I need an adjustment, I go to a chiropractor. But you know, I don't want to go to another acupuncturist to adjust my neck. You know, it's the same thing. So. You have to do it that way. Yeah.
Okay, so we're way over on our time, so we're gonna wrap this up. But there's one question that keeps popping up, so we're gonna I'm gonna ask this last question, and this will be our last one. I thank everybody who hung in. I know this is normally just an hour, but we had such a big panel, and Misha's in Mexico, and she got booted off, so she said sorry. Okay. What are the characteristics of the Shaoyang stage, and can you explain more? And Dr. Wen, I'm going to go for you on that one.
So the Shaoyang stage, you translate that into conventional medicine, is basically any problem you have with the lymph system, or any problem you have with the fascia, interstitial tissue. So that is pretty much like a Shaoyang issue. And Amy mentioned earlier, it's like, okay, you have the alternating, like you sometimes you feel better, sometimes you feel worse. You know, that like pattern, better, worse again, that is what we call Shaoyang. Yeah. So any chronic issue. So you translate that into conventional medicine, a lot of those like autoimmune disease you look at that actually fit in perfectly. That's a Shaoyang issue. And so anything related to the lymph system, related to the interstitial system, the fascia system, that's pretty much like a Shaoyang. Yeah. So that if you have a chronic, so that probably enough said. Yeah, you have ME, you have, you know, the chronic fatigue syndrome, fibromyalgia, and that's pretty much also even the multiple chemical sensitivity. All those things that you're talking about fit in, yeah, the Shaoyang issue. And when it comes to conventional medicine, when it comes to like a brain inflammation, when we're talking about the brain fog, you know, basically all the cognitive impairment, all that is we have brain inflammation. But in conventional medicine, we don't have a way, like effective way to reduce that inflammation, because there's the BBB, you know, the brain blood barrier.
The brain barrier.
Yeah, naturally, that is actually our brain's defense mechanism. So make sure all the toxins cannot be just flushed into your brain and causing damages. But by the same token, you know, if it's trapped inside of the brain, they have trouble to come out. Yeah. So how to get them, you know, everybody loves the idea, detox. But don't forget, you have a lot of toxins coming out. You have the experience, patients don't feel right. They get more irritable, they got a lot of, you know, more anxiety. So that's, you got too much toxin in the body, in the system, in the brain. the brain cannot function. So how to get rid of those toxins by like activating your lymph system, by activating your fascia system, your interstitial system. So those are actually the ways, better ways to remove the toxins. That's why, back to my point again, it's like from Chinese medicine perspective, Shaoyang-Bing is actually designed, all those formulas from Shaoyang-Bing designed to address those issues. So that's why they can treat all the problems we're talking about. But in conventional medicine, unfortunately, you don't have a very effective way, to address those issues.
So this is a diagnostic pattern of a level of where the illness is and how the person manifests it. It can be from an external source coming in to the body and the body going between fighting an external and having internal symptoms as well. That's a very, very layperson's way to try to say, and then in Chinese medicine, it gets so complex on how to clear this and how to address this. There's bodies of works and formulas and approaches to where when we see people going, I don't know why, and they're going, their doctor going, why? What Dr. Wen and Amy are saying is, this is a specific pattern in Chinese medicine that has a lot of ways to address it. So I hope that can kind of break down, but you can see how complex it is. So no, a chiropractor with 200 hours and even an integrative MD who took, 200-hour integrative course cannot prescribe Chinese herbs. They can't. It's so complex. Even a lot of acupuncturists are not qualified. I get their patients. I see their protocols. It requires lots of experience and dedication to these type of illnesses.
And specificity. And one of the things that I believe we've all spoken about and that Dr. Cohen also spoke about was, the formulas may change at different times. I mean, we had COVID in our house. I have 6 children. All 8 of us went down like dominoes, but there were 4 different presentations in our household with COVID. So there were 4 different formulas that were going on throughout, that I was feeding people throughout the day. And I'm still taking Chinese herbal medicine because I don't feel well enough unless I do. So please don't be disappointed. I mean, this was March 2020. It's the longest I've ever taken Chinese herbs, but I will continue to take them because when we feel better, when we take them, we will continue to take them. It won't be forever, but it may be longer than you think because of the specificity, again, the right remedy at the right time in the right context. And I would add to that for the right length of time.
Absolutely, because length of time is really important. If you've been sick for 30 years, it's not going to take a month to restore your health. It's going to take a lot of time. A patient once told me, when you choose to go this route, you have to be all in. You have to be compliant, followed. It's not just taking a pill, it's addressing all aspects. It's taking the herbs, it's adjusting the diet, it's doing the movement, it's getting the massages, it's changing your outlook. I mean, there's so many things that go to creating health, and plus time.
Nature, patience, and time are the 3 greatest healers.
Absolutely. So I thank you all for showing up today. I thank everyone who's hung in here. We have gone way over time. I hope that maybe we can come back at another time and do another health talk because there was just so much to say. I thank our panelists so much. I thank Mass ME. We will provide resources with the recording. So thank everyone who showed up today, panelists, hosts, participants, patients, other healthcare providers. This has been a wonderful event, and you're welcome to look us all up on social media, email, look at our clinics. We'll put that in our references, and we thank you so much. And also, please join next month. We have Emerging Similarities of ME/CFS and Long COVID and Why It Matters with Dr. Anthony Komarov. So we thank you so much. Have a wonderful Sunday. Thank you, Dr. Wen. Thank you, Amy.
My pleasure. Thank
Thank you,
you.
Christi.
Thank
Thank you,
you.
Dr.
Thank
Wen.
you. Thank you.